welcome to Porchlight, a presentation of Porchlight VNA and home care, providing top-rate, highly personalized care for individuals and families within the Berkshires and also the hill towns of Hampden and Hampshire County, all in the comfort of home. And when you've been in the business of healthcare for more than 100 years, serving southern Berkshire County and now a larger region, there's no doubt that there is a great integration between what you do and public health. So I'm very happy to welcome to the program someone who knows quite a bit about public health and who has worked with Porchlight for some time. He is Jim Wilusz, who is the director of the Tri-Town Health Department. So Jim, it's a great pleasure having you on the show.
Thank you for having me on the show, John. It's a pleasure.
It is great to have you. And you know southern Berkshire County, of course, actually Berkshire County. You worked in Pittsfield for some time. That's where we met. But also have a lot of experience in Tri-Town before coming back now as the director.
Yeah, absolutely. Public health is a very diverse field, and I worked at Tri-Town Health Department coming out of college after spending 8 years in the Air Force. And I started out as an intern working for Peter Koloje, who is the longtime director at Tri-Town. I retired a couple years ago. And I started at the ground level doing pool testing and learning the ropes of public health while I was trying to put myself through college. And I loved working with the community, and if you want a career in public health where you're working one-on-one with not only individuals but as a community as a whole, local public health is the place to go. You can create initiatives, work on public health collaborations, and actually see changes within the community for the greater good of public health and safety. And I fell in love with public health when I first started out, and so I worked my way up the ladder, was promoted to senior inspector until 2008 when I had the opportunity to be the public health director in the city of Pittsfield. And John, you're right, that's when we first met, and we had a really good relationship up there, and we still do, and we did a lot of initiatives up there. But unfortunately, when Peter retired and I decided to move on and come back to Tri-Town, and not for a lot of reasons. It's just it's an interesting community. I was very familiar with South County, and I've been back almost 3 years, and we've done a lot of great initiatives, and we're still able to collaborate with the city of Pittsfield and many other boards of health across the county, and I think that is something that I was always interested in, and so I get the best of both worlds.
I think it's interesting also because we know that public health doesn't have borders. The issues that impact the public health, it doesn't. It can cross city lines and so forth. So we have this community where everything that is public health, it does affect us.
Yeah, and you're absolutely right. And county government is not around anymore. And we, Tri-Town, we're the only health department district in the county. Tri-Town was created in 1929 from a milk outbreak, and so the three towns got together and hired a milk inspector, and it evolved ever since. And since 1929, I'm the third director at Tri-Town.
That's amazing.
Since that time, so there's a lot of stability and longevity with Tri-Town. But you're right, there are no borders in public health. And when I first realized that in my public health career, and I actually was the city of Pittsfield public health director when we had the H1N1 virus epidemic, and we know there's no county government. Each town has their own independent board of health. Some may have a lot of resources, some of the smaller hill towns don't. And the H1N1 virus, as many other public health issues, affect all of us. You may eat out at a restaurant in Pittsfield, you may live in Sheffield, and we all need to be communicating together. And so when we were dealing with the H1N1 pandemic, I led the charge and created a bunch of collaborations with VNAs and public health nurses and select board members, city councilors. And we created a central district for the H1N1, and we pulled in all the resources, and we held mass vaccination clinics. And it was at that moment in time when we had 3,000 community members go through that clinic. Many were from the city of Pittsfield, some were from out of the state, and some were from South County. And it was at that point in my career I realized, there really is no borders in public health. This is a Berkshire County issue. This is a Commonwealth of Massachusetts issue. It's a national issue. And it was then I really started focusing a lot of my energy on, shoring up existing collaborations, finding new collaborations and partnerships, and try to get this thing done in Berkshire County. And that was just one example of many of we're all in this together.
Right, and I think those partnerships are very important because I think it makes things perhaps more efficient when you have different organizations within the community that have the skills and expertise to be able to provide that, as opposed to trying to rely simply on a board of health or a department of health and that sort of thing. So being able to work in the quote-unquote private sector, but really typically nonprofits like Porchlight and others, it seems like it's an efficient way to go about things.
It is an efficient way. I mean, the resources are limited. I mean, I think we've really felt the pressures from a municipality perspective. We've had some down years, and funding to fund the health department and other municipal departments is a challenge. Whether you're a nonprofit, you're a municipal agency, or in the private sector, I think we're all faced with limitations on funding, and you need funding to get programs going. You need staff to move those programs forward. And so when these, like for example, when grant opportunities come up, it's the norm now that you will only get grant funding unless you have multiple partners from multiple communities, because the resources are scarce. And if a state agency or even the Centers for Disease Control, for example, they're going to give limited dollars that are going to spread throughout the county. And so we need to be good at what we do and having great relationships and collaborations and still meet the needs of each individual community, because Berkshire County is very dynamic. I mean, we have large cities, we have very small towns, and it's not a one-size-fits-all type resource and needs for every community, and that's a challenge as well. So it's really working together as a team. And in Tri-Town, we have a very great relationship with Porchlight, and we're always working in collaboration to try to find resources and grants and providing the services that the community needs.
And we'll talk more about some of the work that Porchlight does for the community, because we're going to bring a couple of our registered nurses from Porchlight to join us. But I know there are some initiatives also that you wanted to talk about that are really at the forefront of what the department is doing, and some of it has to do with statewide initiatives, basically to improve the the level of healthiness within the menus in our restaurants.
Yes, and we got a lot of initiatives we're working on, because I think local public health has really evolved over time. Back in the old days, it was really the septic inspections and working on the food service regulations. We've really been put to task with emergency preparedness. We saw since 9/11 that boards of health and public health wasn't directly involved with emergency preparedness planning. And we're going from emergency preparedness planning to health and wellness initiatives, because let's face it, there are no borders with the overweight and obesity issues across the nation. We're seeing high percentage numbers in our kids, over 30% in Berkshire County. We're seeing it across the state, and we're seeing it nationwide. And there's a lot of efforts in place right now to deal with overweight and obesity issues, and trying to increase access to healthier foods, and really trying to educate our non-traditional partners like our city councilors and our planners, trying to make our infrastructure more accessible so it's easier to exercise and it's easier to eat food when you do decide to go out. And so one initiative we've been working on since 2009 was our Mass in Motion program. Mass in Motion, for those that aren't familiar with that, it was a statewide Governor Patrick initiative to increase healthy eating and active living. And so certain boards of health across the Commonwealth were funded initially. It was a 2-year grant. The first year was to plan, and the second year was to implement. The crux of that original grant was to work with the select board members, work with the planners. When you're doing a subdivision, ask those interesting questions. Is it well lit? Are there sidewalks? Are there connectors? Are there connectors to green space and parks? Because the way zoning is set up now, everything's in a silo. You have to drive from point A to point B, versus the old days where everything was more centralized. You could walk to the farmers markets, you could walk to the stores, but we've become so isolated through zoning reform and just evolving as human beings. It's making it very challenging to exercise and to access healthier foods. And we're also working with restaurants. That was the second part of that, increasing healthier food choices. And so one of the programs that we have now through our Be Well Berkshires initiative is we have over 60 restaurants signed on to the Healthy Dining program. And what that is, it's a voluntary program, John, where we go into the restaurant, we work one-on-one with the owners and the managers and the staff on trying to educate them on the healthy issues in Berkshire County and the overweight and obesity, and trying to get them to think outside the box, change their menus, and start offering healthier food choices. And in return, we give them public recognition, and we highlight them through media, television shows such as this. And it's been going pretty good so far. And we just created a brand new video highlighting some restaurants, and it's really a sustainable way of working together with the restaurateurs, which we also permit, which is always it's a non-traditional relationship, because it's always the permit holder versus the Board of Health.
You're always you're the bad guy, you're the inspector coming in that everyone is afraid of. It shouldn't be that way. It should be a relationship. And
now we have this new dynamic. I think it's a secondary dynamic that what we're seeing is we're going in there, building those relationships, and they're saying to themselves, wow, they really care about me and my restaurant and the people that I serve. Because I think a lot of the restaurants that have been champions early on say, well, they're overeating, they're feeling sick, they're not coming back. It's not so much the quality of the food, it's the quantity. And so we're trying to build upon that and support other policy-related actions.
Yeah, and that being healthy and providing those options actually is good for the business overall, because I think there is an understanding with a lot of people who are going out to eat more often, it's just the way it is, but that they need to eat healthier, because we all know that that's going to make us happier and healthier overall, so give those options.
Yeah, and obesity is a disease. I mean, the amount of money that we're spending ourselves and what employers are spending and what the state and federal government is spending is astronomical, and we need to get a handle on these overweight and obesity issues. And what we're trying to do is make it more accessible. When you go into a restaurant and you're trying to find a healthier choice, you get this little section in the back of the menu at the bottom that has the healthier options, and trying to collaborate and work together on, if you go into a restaurant, there's five menu items, and 4 are healthy and 1 is the unhealthy, there's a high likelihood that they're going to choose one of the healthier options. And I think customers are asking those questions now. I think we're very smart as a society, and they're asking those questions. They're putting the restaurant and the wait staff to task. Do they have gluten? Are there reduced portion sizes? Can I substitute a starch with a vegetable at no cost? And I think the restaurants that recognize and understand the role that they play, they're now taking a leadership role, and they're listening to their customers, and they're offering those healthier choices. So what we're trying to do is build relationships, bridge the gap, and at the same time deal with these imminent public health issues that are affecting all of us, from an acute perspective to chronic long-term health issues, from not eating healthy, not exercising. And this is one step in the right direction of many initiatives that we're working on.
And public health, of course, is just so diverse. We could go on and on, because everything from anti-tobacco campaigns, we talked about the diet, and also allowing people opportunities for the exercise by impacting our infrastructure in a positive way. So there's so much, but of course we have a limited amount of time. So what we're going to do is we're going to take a break real quickly, and we'll be back with personnel from Porchlight who are involved in public health along with Jim Wilusz. So we'll be back right after this. And welcome back to Porchlight. We've been speaking with the Director of Tri-Town Health, Jim Wilusz, about the integration between the work done by Porchlight VNA and home care and also Tri-Town Health within the community. And so I'm very happy to welcome to the program Karen Farkas, who is a registered nurse for Porchlight VNA, and she's very much involved with public health, with things like blood pressure screenings and flu clinics. So Karen, welcome to the program.
Thank you very much for having me.
It's great to have you, and I love to see these partnerships because Jim and I were talking earlier about the level of expertise available in the community, and it seems to make a lot of sense for a Department of Health to be able to contract out essentially with Porchlight that has these types of skills that you bring to the table. So tell me a little bit about the scope of some of the work that you're involved in.
Well, Porchlight's a wonderful place to work. I came a little over a year ago, and my role there is to do the blood pressure screenings. We do service many of the communities within Berkshire County with monthly blood pressure clinics. They're about an hour, and I get to see some of the regulars. Most of them are seniors, most of them are council on aging, and we'll go in and at a time when there's a lot of seniors there, you know, they're having their luncheons, their bingo, whatever, so I can get to screen a lot of the patients. So we do it monthly at each of those towns, 2 days a week, and then once a week we do it weekly at our offices on 21 High Street in Lee. And then Joan, my colleague Joan, goes to Stop and Shop up on Merrill Road once a week, also for about an hour and a half. So we get to, for about 4 days a week, we get to cover a lot of territory with blood pressure screenings.
And tell me a little bit about why the blood pressure screenings are important. And I know there's some anecdotal evidence, and we've had examples of where we've been able to really catch some health issues and incidents, essentially, and
Absolutely.
be able to catch that before with this type of screening.
Absolutely. Well, the blood pressure screenings, or the clinics, actually involve more than just blood pressure screenings. We measure their weights if the individual would like. We do a lot of teaching, and it's not just for blood pressure, it's other disease entities. You know, we'll go over side effects of their medications and risk factors for things, and we touch a little bit on nutrition. So it's a pretty comprehensive, other than just blood pressure. But blood pressure is a very, very common illness in most individuals. And many individuals can walk around and never know that they have high blood pressure because there are very few side effects. And by the time people have side effects, it is quite a serious illness. And undetected high blood pressure can lead to heart disease and stroke and kidney disease. That's most of my career was spent taking care of kidney patients, so it's very apparent. We had an occasion recently at one of the towns where there was a young man. He was in his 40s.
And by the way, we should suggest that this isn't just for senior citizens.
It isn't. It's open to the public. It's free.
And that's one of the points I wanted to make, because yes, it's open to the public. It's free. And when you're talking about some of these factors, ideally, yes, you want to catch them when you're in your 30s and 40s and 50s before you're hanging out at the senior center
Even
all the time.
Children need to be screened for high blood pressure. They're usually done at their well visits with their pediatrician. But we had a young man, he was in his 40s, a town employee at one of the towns that I was covering, and he says, oh, what the heck, I'll check my pressure, I'm fine. And he came over, and lo and behold, his pressure was over 200, and I said to him, you need to see your doctor today, and if you can't see your doctor today, you need to go to a local ER because you could have a stroke. And he did follow up on it, believe it or not, and then he came back to me month after month, for his blood pressure screening, and I said, listen, learn how to take your own blood pressure at home. But he was put on medication, and and now he's controlled. He's doing fine.
And in this era, Jim, of healthcare reform, as we're having this discussion, trying to understand how do we make the system more efficient, and how do we bring in a preventative factor into the dialogue and into basically making that the normal situation. In the United States of America, it's not easy to do that because we don't have a system like Canada and so forth, but something like this provided through, I assume, grant funding and so forth, that's an important thing that people really got to know about.
Right, and the services that Porchlight provides is not really grant funded. The towns actually pay for that service.
I see.
Because part of the Board of Health requirement is to offer public health nursing services, and we've been in the towns of Lee, Lennox, and Stockbridge, and many others outside of our district. They pay the professionals, to do this professionally. And with blood pressures, I think it's very important because I think a lot of people don't know their numbers. They don't understand what pre-hypertensive is, and I think Porchlight does a very good job at that. And people, in an ideal world, we all want to self-manage our chronic disease issues. How to properly take our medications, inventory what we're taking, how to relieve stress and balance work-life, issues there. And I think having Porchlight and other professionals out in the field offering these services free to the public, to them, is another step in the right direction. And I'm almost 40, and I know what my numbers are, but I didn't know what they were 5 years ago. But it's catching in catching that 40-year-old where his blood pressure was obviously above normal operating range, and getting him back to his primary care and going on medications, and maybe somewhere along the line someone's educating him and his family on healthy eating and exercise, and get to a point of not relying on those medications, but to control it in a certain way. These are just a lot of services that Porchlight provides, and I think is essentially, there's a need in Berkshire County and in any community for that, because if those services aren't being provided, I mean, going to the Stop and Shops and Price Choppers and putting your arm into the free cuff doesn't, it's great, but we need the one-on-one.
In addition to,
we need the professionals out there working with these folks, helping them understand what those numbers are, and setting an action plan to prevent chronic issues in the future.
Yeah, and we always talk about that. It's not just about providing, and even with Porchlight, when they are providing services within the home, it's not simply about just providing care. Part of it, and a big part of it, is about education. And the more, Karen, that patients and individuals who are, we hope, interested in their health, the more that we can educate them, the more effective the entire system would be.
Yeah, that's absolutely correct. And most patients do not know. They're unaware, and they're unaware of how blood pressure can affect their other organ systems. And besides blood pressure screening, some of the other preventions are, we do a flu clinic every year, many flu clinics every year. Last year it was quite busy, and we anticipate this season to be even busier. So providing flu vaccine is a wonderful prevention, and we get out there to not only to towns but to businesses and things like that. So it's a wonderful program.
And there's another program known as the MAVEN program. Jim, tell me about that a little bit.
Sure, and MAVEN is the electronic surveillance data reporting. For example, boards of health are required to report and investigate on all communicable diseases, whether it's a foodborne salmonella issue or a hepatitis B or a perinatal hepatitis B. And the goal of that is, A, we want to follow up with the patient when we get the information from infection control, make sure they're okay and they're on the right path for recovery, and B, prevention of further spread. When we get a foodborne illness outbreak or waterborne illness, we want to control that because we have a community-wide spread. And so in the old days, we would get the fax copies from Berkshire Health System's infection control. It would go to the Board of Health. The Board of Health would then try to follow up, or whoever the public health nurse contractor is, if they don't have a staff person. And so what the MAVEN system has done, it's a Department of Public Health initiative where I think most of the boards of health and communities are on that. And so Porchlight nurses, they have direct access to infection control. It's real time. So the staff will know who that person was with a communicable disease. They'll be able to immediately follow up and do all the reporting. And now we all have the luxury of getting all these reports, so it's real time. Back in the old days, you would get a person with a communicable disease in Sheffield, or for example, and they would fax it to Pittsfield, and they would sit at the bottom of the pile. And meanwhile, you're getting multiple people being affected in a food service establishment, or they're drinking water that is not potable. And so what Porchlight does is they oversee the MAVEN for our 3 towns, and they do all the investigation follow-up with that process. So it's a wonderful piece of technology, and it's just another example of why public health is important on minimizing disease, educating, and offering prevention.
And yes, technology is, and I think, you know, when we look in the healthcare system overall, it's so far behind many other industries as far as making everything electronic and more efficient. And I think there's been an effort over the last several years nationally on through to make that more efficient, because it will. I mean, when there is, especially in the case of an emergency, when you have a communicable disease or these types of things, the personnel who deal with this have to know about it, and then the community ultimately needs to know about it immediately.
Yeah, and it's especially, I think it's a great piece of technology for us, because I would get the fax copies from infection control, and Porchlight may have not received it, and I'd be on the phone with the staff saying, "Hey, we'll do the inspection, you do the investigation." And now it's the opposite. Porchlight, they get the first contact. You know, they're sort of like the first responders for us for communicable diseases, and they're the professionals, and they know how to investigate and follow up, and they keep me in the loop when I
That's
need
right.
to know.
I'm sure they do.
But they do a wonderful job with the public health nursing services for our 3 towns, and I'm sure many others.
As we're running out of time, I want to make sure that we do our best to get the word out about the blood pressure screenings and other public events. So Karen, again, when and where are these blood pressure screenings? And again, they're open to the public, and there's no age limit or anything.
No,
you know, you can be a child or a middle age or a senior citizen, and anything in between.
Well, we do the screening in the different communities, and for a schedule of those, you know, they can call our office, 243-1212 in Lee, and get an exact. We also do some advertising and you know, some of the local papers and what have you. And I get a lot of patients actually from those advertisements coming to the clinics. We're getting a lot of summer people now, you know, dropping into the clinic while they're here. But for more information, they could contact our offices. You'll
I believe it's also on the website too.
It's on the website, right?
Yeah, porchlighthomecare.org. Yeah.
And you'll find us at health fairs, and we'll be doing the blood pressure screenings in conjunction with the flu clinics, also all fall, you know, all during the fall months. So.
Well, fantastic. And Jim, with Tri-Town, how can people get in touch with you?
243-5540, info@tritownhealth.org, and we also have a quick link for Porchlight on our website. So it's another example of collaboration and integration, and keep an eye out for those healthy dining restaurants in Be Well Berkshires.
That's right. That's right. So Jim Wilusz, a great pleasure.
Thank you.
Always seeing you and having you on the program. And Karen Farkas, thank you so much from Porchlight. And this has been Porchlight, a presentation of Porchlight VNA and Home Care. I'm John Krol. Thanks for watching.